I'm Flo Barber-Hancock. I'm a licensed massage therapist. I'm also a Ph.D. in neurosensory rehabilitation. I am Director of Education at Hancock Craniosomatic Institute. We provide continuing education classes for healthcare providers and focus on holistic evaluations and cranial techniques. I'm very happy to be here at Oakworks today. I'm using their Prolux convertible table, and I'll be demonstrating some techniques for holistic evaluation and several different types of integrated treatment. First thing I'd like to talk about in terms of holistic treatment and evaluation is beginning by doing a whole body evaluation. This requires a thorough history. And today, I've already had some conversation with our model. Jerry, would you join us, please? Right here. Jerry has shared with me some of her history, and so I have an idea of how I want to begin. And a thorough history is important because if you don't know a person's background and a lot of the different things they've done, you'll miss a lot of the things you really need to know in terms of doing effective treatment. So, Jerry, I'm going to ask you to lay down on your back and head right up here at the top of the table. That looks great. I'm going to be doing evaluation on the whole body because if you don't evaluate the whole body, then you really don't know what you might be missing in terms of treatment. So I'm going to start with a leg over here. Jerry, would you lift your leg up straight, please? Hold. And that seems pretty firm. And bring this one up, please. Hold firm. Not so much. Let it come down. That one dropped right away, so we have some problems going on over there that we'll want to look at. The problems that Jerry's are of more immediate concern to Jerry are relating to her shoulder, particularly her right shoulder. So I'm going to ask you to bring this arm up. Can you hold that there? Hold. And that seems pretty firm, and bring it out to the side. Hold it out here. Hold. And that seems pretty firm, and bring it in. Now, did either of those cause discomfort up here, Jerry? No. No. Okay, but we've seen a strong test there, but a weak test over on this leg over here. Up, hold, and this is coming down. So we put it down. What I'm looking at is the fact that there's probably a relationship going on from this shoulder over to this hip as a result of frequent use, probably some underlying patterns also, but frequent use. So I'm not going to focus my treatment just on this shoulder. I'm going to start by, because I do cranial techniques along with other techniques, I'm going to do a little bit of cranial balancing first. Also, if you don't use muscle testing, you can use other techniques that you use to access what's going on with the body. Particularly look for subtle patterns. You might want to click into energy modality if you're good at reading that. I'm going to come up here and do a little balancing at the cranium. So I'm just going to cup the occiput here and do a little balancing here. I just want to try and create more balance in the structure. And just a little bit of structural technique here. Nothing real heavy, just improving the function somewhat. I've done a little bit more work off camera on doing the facilitated pathways strokes on her head. I've also done a few myofascial strokes in the trapezius area. These are not the typical myofascial strokes that are long. These are very short strokes, still using the facilitated pathways concept of very short strokes. And I've been working there on the trapezius muscle, which of course has many attachments onto, or very strong attachments onto the head as well as onto the neck. And it's really important, as I was mentioning earlier, that we look at not only what's going on with the shoulder, but also with the leg, because the body is integrated head to toe, it's continuous fascia, and we have to look at both parts. I'm going to ask you to hold your arm up here again. Hold. All righty. Looking better there. And bring it down. And turning your arm in here. Is this a little more comfortable now? Mm-hmm. All righty. And I'm going to do a little joint mobilization because I've had Jerry laying down for a few minutes. And depending on the pattern that a person comes in with, I might also do this at the beginning of the session. I'm going to lift a little above the knee with a slight pressure below the knee. And I'm going to reverse that, just doing a little A to P, joint mobilization at the knees and the ankles. Because we can't do everything at the head, and not everything, even when we're doing muscle strokes, clears up all the things we'd like to clear up. So I've done some joint mobilizations here. I've done some cranial. I've done some myofascial work over here. Integrating treatment is really important. At the close of treatment, I would also generally talk to my patient about other factors in their lifestyle and activities that may be contributing to ongoing dysfunction. Jerry's job requires a lot of right shoulder movement activities, repetitive motion with her hand and arm. We'll talk some more about that in another video. And I'll also be talking with my patient about other factors, things like socks, tight jeans, glasses that are not level on the face, can cause eye strain and stress and contribute to more dysfunction in the neck and shoulder. That's why we think the whole body is important. I'm not qualified to work with things like nutrition, but I talk to my patients about nutrition, about exercise, and encourage them to talk to and consult other practitioners who look at other aspects of health, because all of the body functions together. And if there's nutritional deficiencies or other structural problems or problems from outside, like a stool that's too high at work, a computer mouse that's too far away, or too many repetitive strokes of the same kind when you're in body work, those things can contribute to an ongoing pain pattern, and they can be changed by conversation with your patient. But if you don't talk with the patient about them, then they may not be investigating those other factors. Jerry, thank you so much for being my patient here today. I want to thank Oakworks for the opportunity to be here using their Prolux table. It's a pleasure to have a table that rises and lowers to just the height I needed. It's really great. And I'd like to invite you to learn more about our classes. Contact our website, take a look, call us. Hancock Craniosomatic Institute. We're at craniosomatics.com. We do classes and workshops for healthcare professionals about holistic evaluations and cranial therapies that change structure and function. Thanks again. My name is Flo Barber-Hancock, and it's been a pleasure to talk to you today.